to talk about the heart here. And in this chapter, we're going to talk about just an overview of the cardiovascular system. We'll talk about the anatomy of the heart, which we've gone over in lab, but we'll go back through it again here. We'll talk about coronary circulation, so blood vessels of the heart and how blood flows to the heart. We'll talk about the cardiac cycle, so how the heart beats and what happens in an individual heartbeat. Some of the innervation or nerve supply to the heart, as well as just tying it all together. So talking about the electrical events, mechanical events, all together in time. And it's just a good way to talk about the heart. So what this first slide shows you guys is just the difference between arteries and veins. You know, I think if going back to like middle school science or like maybe a high school science class, I remember learning arteries carry oxygenated blood. Veins carry deoxygenated blood. All right, and that was kind of the end of the story. But that's not entirely true. A better definition is that arteries carry blood away from the heart. Veins carry blood back to the heart, right? Which usually means oxygenated blood you find in arteries and deoxygenated blood you find in veins. But when we talk about the heart, we realize that that rule doesn't always work because there are some arteries associated with the heart that carry deoxygenated blood to the lungs, and there are some veins associated with the heart that carry oxygenated blood back to the heart itself. Okay, so a better definition, you guys, is that arteries carry blood away from the heart, veins carry blood back to the heart. Now, they are anatomically different. So arteries have a tendency to be much thicker. Like the walls of the artery are thicker. Because they're going away from the heart, they're coming from the place where pressure was generated. So that means that arteries are going to contain the highest blood pressure. And then that veins, because they're actually going back to the heart and they're presumably the farthest away from where the pressure started, veins will have the lowest blood pressure, so their walls are much thinner. We'll talk about the structure of these vessels later. Like we'll go through the structure of arteries and veins next week. So all the vessels that either enter or exit the heart, you guys, we call the great vessels. So we learned about how there's the superior and inferior vena cava. We got the aorta and pulmonary veins, pulmonary arteries, pulmonary trunk. Those are the great vessels that emerge from the heart and either carry blood away from the heart or bring it back to the heart. Those are the great vessels. So what's nice, though, is that our heart works as a unidirectional pump. You know, the heart is a muscular pump, and it's basically what keeps your blood pressure elevated. It also helps keep your blood moving. And we want the heart to function as a unidirectional pump because we only want blood to flow in one direction. We only want blood to flow, you know, either to the heart and then to the lungs and back again, and not back to where it came from, because that would be pretty inefficient if blood had any kind of backflow. So blood flow is unidirectional, and what helps keep blood flowing in a unidirectional pattern are differences in blood pressure, because blood only moves from high to low pressure, as well as some of the valves in the heart. So the heart valves also prevent backflow. So you have pressure changes and these valves that allow for blood to move in one direction. And if it doesn't move in one direction, you can get some issues that arise. Now, we could divide the heart as a two-sided system. We have a right side and a left side of the heart, right? So the right side of the heart would be like the right atrium, right ventricle. Left side of the heart would be left atrium, left ventricle. Well, the right side of the heart we talk about as being part of the pulmonary system because it pumps blood to the lungs. And the left side of the heart we talk about as being part of the systemic system because it pumps blood out to the rest of the body, okay? So it turns out, you guys, that our heart generates this blood pressure. Remember, I said that blood pressure is the thing that keeps blood flowing. Without a difference in blood pressure, blood wouldn't flow. Like if blood pressure across all of your vessels were equal, blood couldn't flow anywhere because blood only moves from high to low pressure. So what that means is that the heart is keeping this pressure elevated by pumping consistently, which allows for blood to continually flow. And without that heart pumping, then your blood couldn't flow. Now, we'll go into more on blood pressure and how it's regulated in the next chapter, but we define blood pressure as the amount of force that's being exerted on the wall of a vessel, and we can measure this either internally or externally. You know, externally would be what you guys have done before, like a sphygmomanometer, right? Or the blood pressure cuff. Or we can even do it internally with like an interarterial catheter, and you can get like more of a precise digital readout of blood pressure. Okay, but basically it's just the amount of force that's exerted on the wall of that vessel. That's what blood pressure is. And then which way does blood flow? Only from high to low pressure. So what if there's lower pressure, you know, on one side and higher pressure on this side? Right. Yeah, you got it. Blood's going to flow in that direction from high to low. It will not backflow. Okay, it's only going to flow due to pressure changes. It can't go against that pressure gradient. You know what I mean? An example of this, you guys, is like, and this is sort of counterintuitive, but like, you know, super soaker, and you spray it, Well, the reason why that water is spraying out of the super soaker is that you have higher pressure inside your chamber that you've pumped up, and there's lower pressure outside of that. You would never have the case where that water flowed back into your super soaker back in the tank, right? That goes against the laws of nature. So same thing with blood flow. Blood will only flow from high to low pressure. Now what we'll find though, there are circumstances in the heart where blood could flow back to where it came from because you could actually have pressure changes in the heart. Like it's possible that you might find that in a particular area of the heart, pressure might be lower now than it was before, and blood might want to flow back to that area of the heart. But what prevents that are the valves. So your heart valves prevent backflow of blood with these pressure changes, and we'll come back to that later. So remember, there's two sides of the heart, right side, left side. Which side of the heart was associated with your lungs? Right. The right side of the heart, right? So the right side of your heart pumps blood to the lungs. The left side of your heart pumps blood to the body, the systemic circuit, right? So we can talk about the pulmonary and systemic circuits of the heart. The pulmonary circuit is the right side of the heart, and that's where, the systemic veins bring blood to the right side of the heart. Then the right side of the heart pumps blood to the lungs. The left side of the heart receives blood from the pulmonary veins, and then it pumps blood out to the rest of your body, okay? So we'll talk about right-sided and left-sided heart failure, like in pathophysiology. But it's important to note that the right side of the heart is the pulmonary circuit, left side of the heart is the systemic circuit. And that's basically what this slide is showing here, you guys. So what does blue mean on these anatomy drawings? Deoxygenated. Yeah, right. So does that always mean it's a vein? No, exactly. So let's go over why that is too. So we're seeing a diagram. It's a very simplistic view of the body, but we see the right side of the heart is receiving deoxygenated venous blood from the vena cava. Then the right side of the heart is going to pump that deoxygenated vein of blood out through the pulmonary trunk through the left and right pulmonary arteries, which carry that blood to the lungs. So the pulmonary arteries then are some of the vessels in your body that they're arteries, but they carry deoxygenated blood, which kind of goes against what we've learned in the past. But these pulmonary arteries, they carry that deoxygenated blood to the lungs. And because they came from the right side of the heart, we talk about the right side of the heart as being part of the pulmonary circuit. So it's pumping blood to the lungs. Then what we find is that the pulmonary veins carry oxygenated blood back to the heart, which then drains that oxygenated blood into the left side of the heart. And we talk about the left side of the heart as being part of the systemic circuit because it pumps blood out through the aorta to the rest of the capillaries of your body. Like this could be capillaries in your brain, it could be capillaries in your arm, this could be capillaries like in your abdominal organs or legs. So it's a more simplistic view of the vessels of your body and where that blood goes, but it illustrates this process really nicely, how the right side of the heart receives blood from systemic veins and the left side of the heart receives blood from pulmonary veins. So I'll give you guys a guess this then. If someone had right-sided heart failure, like let's say that only the right side of the heart was failing to pump blood, where would blood back up? Where would that blood be backing up if the right side of the heart couldn't pump it or move it along? It's going to back up from where it came from, right? The veins. It can't drain the blood that's going to the right side of the heart very well because if it's not pumping along, and the left side of the heart is still pumping blood along, well, blood starts backing up then in the right side of the heart because it's failing, and its associated vessels, which would be the systemic veins. So one of the things you see with right-sided heart failure then is venous engorgement. Like the jugular veins get all big, and just veins around the body get big because that blood's backing up in those systemic veins, right? How about if someone had left-sided heart failure, like the left side of their heart was failing to pump blood or move blood along, where would that blood back up? Arteries. Into the pulmonary veins, back into the lungs, right? So if blood's backing up in your lungs, what do you guys think is going to happen? You get pulmonary hypertension, right? Because you have high blood pressure in the lungs, which forces more fluid out into your lung spaces. And you're right, you start kind of drowning in your own body fluid, unfortunately. And call this pulmonary edema, and you can hear it as sort of like crackles in your mouth. Because basically what happens is the airways of your lungs start filling up with water, and it sounds kind of like, when you suck on a straw, and there's like a little bit of water in that straw, and it makes a noise. Yeah, and it makes that kind of slurping noise, yeah. Except this sounds a little bit more like pop rocks. They call it rails. basilar crackles. It's like kind of like pop rocks in the mouth. But the noise is not coming from the mouth. It's coming from down the lungs because they're starting to fill up with fluid. Well, they're filling up with fluid because the left side of the heart can't move that blood along. So blood's backing up in the lungs, and then that's leading to fluid being forced out in the lung spaces. So it's all this interconnected system, you guys. If one thing fails, things start breaking down because it's all interrelated. And so what this slide illustrates really nicely too, you guys, it all has unidirectional flow, right? Under normal circumstances, blood flows in a particular direction, and we'll outline this pattern of blood flow later, like, where blood would flow next. You guys want to know that, right? Like, if I said blood's in the superior vena cava, you should be able to tell me, like, where the next place is going to be, right? Which would be the right atrium. And if blood's in the right atrium, where's it going to go next?
Right ventricle.
Right ventricle. Very good. Okay, so we'll go through that in a little bit more detail in a little bit. Now, we know the heart also moves a lot. Like a normal resting heart rate's around 75 or so beats per minute. And what that means is that the heart will beat at least once every second, right? If not more. And if it's moving a lot, then it has the potential to rub up against nearby structures and cause a lot of frictional damage. Well, what prevents that frictional damage then is the pericardium in part. So if you guys look on this slide here, what we find is that the heart is surrounded by a pericardium. So in white is the fibrous pericardium. The function of the fibrous pericardium is that it actually serves as a nice sort of protective barrier, and it prevents overfilling of the heart. But deep to that fibrous pericardium, we'll find a serous pericardium, which is a nice lubrication membrane, and it prevents too much friction around the heart because it's a serous membrane. So that's part of the pericardium there. Now, we know the heart's also slightly offset to the left. I'm sure you guys have heard that before. But a majority of the heart is just posterior to the sternum, right? That big bony plate, like the chest plate here. It's protected by the sternum. But when we say the heart's slightly offset to the left, it's because the left ventricle kind of protrudes into the left side of your lungs, right? So it means that our left lung is also slightly smaller because the left ventricle is larger and it protrudes towards the left. Now, it's not really appropriate to say the entire heart is all the way offset to the left. It just means the left ventricle is just sort of protruding to the left side of your lungs there. We know the heart also receives, nervous system stimulation. So you can see like the vagus nerves come down here and they innervate the heart. So the vagus nerves provide parasympathetic info to the heart itself, so you can slow down your heart rate. The heart also receives sympathetic nervous system stimulation. We can't see the sympathetic nerves in this picture, but you would actually have some sympathetic nerve fibers from the thoracic ganglia innervate or connect to the heart, and then that can stimulate the heart and cause it to beat faster and more strongly. So the pericardium, you guys, remember we had the fibrous and the serous pericardium. The fibrous pericardium is this tough outer sac. And I can tell you guys that from experience with dissection, that this fibrous pericardium is tougher than duct tape. You can't really tear it that well with your bare hands. Like duct tape, yeah, you can tear it with your bare hands, right? Fibrous pericardium, it's so tough, you have difficulty actually tearing it. And as a pericardial sac here, it prevents overfilling of the heart. So the heart can only fill within this chamber itself. Like it can't fill beyond that pericardium because the fibrous pericardium prevents overfilling. It's because it's a really tough outer sac. But what does this mean if someone has a lot of fluid accumulating inside of that fibrous pericardium? Like what if someone has fluid accumulating inside that little sac there? You're right. The pressure is not dissipating. It's building up inside of this little balloon cavity. It can put external pressure on the heart, and that can prevent proper filling of the heart. Okay. So we'll come back to that also later in like disease classes, you guys. We'll talk about pericardial effusions later. Now the heart also has two main serous layers as well. We got the visceral serous pericardium and the parietal serous pericardium. The visceral serous pericardium is also called the epicardium, and it's the layer of serous membrane that directly surrounds the outside of the heart, right? It's called the visceral layer because it's right on the organ itself. Then we have the parietal pericardium, which is just outside of that. And these two layers of serous membrane are separated by a pericardial cavity, which is filled with serous fluid. So on this slide, we can see this, you guys. So this kind of thicker outer whitish tissue here, you guys, this is fibrous pericardium. It forms a nice kind of tough outer layer that the heart can exist within, and it prevents overfilling. It also protects the heart to some degree as well. Now, if you zoom in on this heart wall here, what we'll find then is that right next to the fibrous pericardium, we got this layer of tissue. This is the parietal serous pericardium. And the parietal pericardium is just the outer layer of serous membrane. That's separated from the visceral layer of serous pericardium, also called epicardium, which is right on the heart. That means that these two layers are separated by a fluid-filled cavity. So the heart actually beats within a fluid-filled cavity. Like when it's beating, it's not really rubbing up under normal circumstances. It's not rubbing up against nearby tissues. So you're not getting a whole lot of frictional damage there. Okay? If you don't have enough of the serous membrane, you can actually have friction around the heart. That can lead to pericarditis, which can be very painful. Okay? If that is chronic, that can lead to some pretty serious tissue damage. Okay? But under normal circumstances, you make enough serous fluid to prevent the rubbing of those tissues because they're separated by that fluid cavity. So the parietal pericardium is separated from the visceral pericardium by this pericardial cavity filled with serous fluid. What's serous fluid made of? Yeah, good. Highly filtered blood plasma. So are you going to find a lot of blood cells inside of serous fluid? No. Nope. How about a lot of protein? Not as much as blood. You're not going to find a lot of albumin inside of serous fluid. You will find other molecules that are better lubricants inside of serous fluid. But you're not going to find a lot of cells or protein because those can cause a lot of friction, if that makes sense. So that's the function here. So what's the main function of the fibrous pericardium again? Protection, and it prevents overfilling. How about the serous pericardium? Lubrication to reduce friction. And basically, it's almost like a frictionless environment, you guys. Like you don't get a lot of friction here. What's the layer of pericardium that directly surrounds the outside of the heart? Epicardium, a.k.a. the visceral pericardium. And then how about outside of that? Parietal pericardium. And they're separated by a cavity, pericardial cavity, filled with serous fluid. Very good, you guys. Awesome. Now, deep to this epicardium, you get a little bit of adipose tissue, some loose areolar connective tissue too. But then deep to that, what we find then is myocardium. Myocardium is all of this, you guys, and it's basically cardiac muscle. And so the myocardium is all just the muscle of the heart itself. But what you don't find, though, is you don't find cardiac muscle exposed to blood inside your heart. That doesn't happen. If it did, that would stimulate blood clots to form. So instead, the inside of the heart is surrounded by an endocardium. And the endocardium is basically like a simple squamous epithelium that lines the internal chambers of the heart. And it allows for blood to move in a nice laminar fashion, so it doesn't have a lot of turbulence. It also prevents the exposure of collagen fibers to blood, so you don't get blood clots normally. Okay? If you have a disease of the endocardium, that can put you at risk for blood clots or other types of damage. Okay? Now, endocardium is what lines the inside of the heart, hence the name endocardium. And it's made of a simple squamous epithelium, which is also the same type of tissue that lines the inside of your blood vessels. So when blood vessels enter or exit the heart, there's no change in tissue. It's all one continuous internal lining of tissue. That way it's not a big shock to blood. Like you're not going to get, blood clots to form because it's all sort of one nice continuous tissue there. Now what's crazy too, you guys, you can see some valves here. The valves are also made of endocardium. But remember, endocardium is like a simple squamous epithelium. So how tough do you guys think these valves are? Yeah, it's a simple squamous epithelium, right? I mean, there's some underlying connective tissue too, but they're not very thick. Like they're actually fairly thin structures. They're tough enough. Like they're tough enough to prevent backflow of blood, but they're not that strong in terms of like if they get scarred through any kind of damage, like through infection or even direct trauma, they're not really resilient in that regard. So once someone gets like endocarditis, and they might get a lot of inflammation from that endocarditis, that can lead to irreversible scar tissue that can really seriously damage your heart valves. This is why people take strep throat so seriously, because strep infections can go into your bloodstream. If it gets in the bloodstream, strep likes to infect the inside of your heart. It loves endocardium, among other places like your joints and skin. But if it's infecting the endocardium, it's also affecting the valves here, right, which are made of endocardium, and you can get valvular damage from a strep infection. So just something to keep in mind. So what layer lines the inside of the heart here? Endocardium. How about the muscle? Myocardium. And then what's on the very outside of that? Epicardium, a.k.a. visceral pericardium. Good. And then you have a fluid-filled space. That's the pericardial space. And then this one? Parietal pericardium, and then the fibrous pericardium. Very good, you guys. Awesome. Do you guys know what this thing is down here?
The diaphragm.
Yeah, very good. Respiratory diaphragm. And you guys see how the fibrous pericardium is actually anchored to the respiratory diaphragm? That means when respiratory diaphragm moves, it also causes your heart to move. So when you inhale, exhale, and your respiratory diaphragm is moving up and down, or down and up actually, then the heart's also anchored to that. So the heart's not loose, can't move around a whole lot. It is anchored to nearby tissues because that fibrous pericardium is connected to nearby tissues. So what cavity would be deep to that then? Yeah, very good. Abdominal cavity, right? So then what cavity is up here? Thoracic, and specifically the heart's in the mediastinal cavity. Very good. Or mediastinal, right? Yeah. Potato. Is that right? I only say potatoes. I don't know the alternate way. We talk about the epicardium, you guys. That's the visceral layer of pericardium. The myocardium is cardiac muscle. It's the thickest of those layers. Endocardium is the internal surface of the heart, and it lines basically, the heart chambers and valves, and it's made of a simple squamous type of epithelium. And this is also showing another view of the heart wall. You guys zoomed in. Now, what's one important note to take away from this picture is that, yes, you got your visceral pericardium right here, which is that simple squamous epithelium. That's underlined by an areolar type of connective tissue, which has adipose in it. But if you look here, all these little red and blue circles, or just actually there's only red ones here, these are basically just blood vessels. So although the heart is pumping a lot of blood, it still needs its own blood flow. And so all of these blood vessels you find in this cross section of the heart are the coronary vessels, which are basically helping to supply the heart with nutrients or help carry wastes away. Wastes like carbon dioxide and lactic acid, if they build up too much, they can damage the tissue. So that those wastes need to be removed by these coronary vessels, which are all interspersed throughout the cardiac muscle and other tissues itself. Inside the heart, we got the endocardium, which is basically endothelium, and it's a simple squamous epithelium. We'll talk more about endothelium next week when we go over blood vessels, and it turns out they're really the same tissue. So it's kind of cool. The heart's aligned with that. So what if someone had myocarditis? What's that affecting? Heart muscle. Good. What if someone had endocarditis? You got it. Internal inflammation of the heart, right? So inflammation inside the heart chambers. What about pericarditis? Yeah, inflammation of the pericardium. Now that doesn't differentiate serous from fibrous, but pericarditis is just inflammation of the pericardium. So you guys can imagine what would happen then. Like if someone had myocarditis that's affecting their heart muscle, then their heart muscle wouldn't function very well, right? Or if someone had pericarditis, what are some of the functions of pericardium? Yeah, lubrication, so it prevents friction, right? So if someone had pericarditis, what might you expect to see then? More friction, which could be painful and also lead to more damage, right? Or endocardium, what were some of its functions? Smooth blood flow, and it lines the valves, right? So if someone had endocarditis, what might you expect to see? More turbulence of blood, potentially, which means you could get blood clots. Or if the valves were failing, what might you see? Backflow. You got it. Or backflow of blood. Cool. So just something to keep in mind, you guys. That we won't talk about a whole lot today. We're going to be going into more detail of that later, but that's just something to keep in mind for now. I know. Now, some of the external heart anatomy, you guys, we're going to talk about the coronary vessels, like the coronary arteries and veins. Now, remember, there's only two main coronary arteries, and they emerge right off of the aorta. So the aorta is what's receiving blood from the left ventricle. We know the left ventricle is part of the left side of your heart, so it's going to have oxygenated blood. So if these left and right ventricles emerge straight from the aorta, they're carrying, I've hit left and right. Yeah, left and right coronary arteries, sorry. If they emerge straight from the aorta, they're carrying oxygenated blood. Turns out the left coronary artery carries blood to the left side of the heart. Right coronary artery carries blood to the right side of the heart. Those coronary arteries eventually lead into capillaries, deep into tissue. Then they come back across the heart as coronary veins. So the coronary veins carry deoxygenated blood, which might have a lot of wastes in it, back to the right atrium itself, where it mixes with the rest of your venous blood, and it goes back into the whole cycle. Okay. Now, you're going to find these vessels in a place called the coronary sulcus or the interventricular sulci. So remember, on the anterior side of the heart, we got the anterior interventricular sulcus. The posterior side would be the posterior interventricular sulcus. And the coronary sulcus is basically what separates the atria from the ventricle. So it's just an indentation or sulcus that circumnavigates or kind of goes around the circumference around the heart, separating the atria from the ventricles itself. So let's check this out. So over here, you guys, is the coronary sulcus, over by the auricles of the heart. So all of this is coronary sulcus, which, hence the name, has a lot of coronary vessels within it, arteries and veins. We have the anterior interventricular sulcus over here with its associated coronary vessels. And on the posterior view of the heart, we got the posterior interventricular sulcus back here. Now what's nice is some of these arteries are named for their location. So if you look here, you guys, we got the aorta. The right and left coronary arteries come right off of the aorta. Here's the pulmonary trunk, which is a good reference point. So if it's to the left of pulmonary trunk, that's left coronary artery. If it's to the right of pulmonary trunk, this is right coronary artery. Now the left coronary artery branches into two almost immediately as it forms. So it branches into the anterior interventricular artery, or left anterior descending, as well as the circumflex artery, which we saw wraps around the backside of the heart. The right coronary artery continues through coronary sulcus until it branches into like the right marginal artery here, okay? But then it also wraps around the backside of the heart and turns into, so here it is again, this is the right coronary, and it branches into the posterior interventricular artery. Now it turns out that the anterior and posterior interventricular arteries connect at the apex. They form an anastomosis, which is when two arteries connect. And the purpose of this is another way for blood to get around a potential blockage, if that makes sense. Now in terms of the veins, we have the great cardiac vein, which is paired with the anterior interventricular artery. We have the small cardiac vein, which is paired with right marginal. And then back here we have the middle cardiac vein, which is paired with the posterior interventricular artery. And all of those veins converge at the coronary sinus. And the coronary sinus is a big old, basically, space for venous blood to aggregate. And this coronary sinus, although it's right by the right by the left atrium here, the coronary sinus actually drains into the right atrium. And we'll see the space where it drains into. What connects the coronary sinus to the right atrium is called the ostium. And the ostium is basically just a small opening that allows for this venous blood to drain back into the right atrium, go into the right side of the heart, and enter that whole circulation once again.